Welcome. In this video, you'll tackle 50 of the most difficult NCLEX-style questions on neurological emergencies, stroke versus increased intracranial pressure, ICP. These advanced questions are designed to sharpen your clinical judgment, strengthen your prioritization skills, and help you quickly distinguish between acute stroke symptoms and life-threatening signs of increased ICP. Read each question carefully. Choose your best answer before the explanation, and challenge yourself just like you're taking the real NCLEX. Let's get started. Question 1. A 68-year-old client arrives in the emergency department 50 minutes after suddenly developing right-sided weakness, facial drooping, and expressive aphasia. A non-contrast head CT shows no evidence of intracranial bleeding. Vital signs are BP 186/102 mmHg, HR 86 per minute, RR 18 per minute, SpO2 96% on room air. The provider is considering intravenous thrombolytic therapy. Which nursing action has the highest priority before administering the medication? A. Lower the blood pressure to less than 120/80 mmHg using 4 antihypertensives. B. Verify the exact time the client was last known to be neurologically normal and assess for contraindications to thrombolytic therapy. C. Insert a nasogastric tube before administering thrombolytic therapy. D. Delay treatment until the blood pressure normalizes without intervention. Answer. B. Verify the exact time the client was last known to be neurologically normal and assess for contraindications to thrombolytic therapy. Rationale. Eligibility for thrombolytic therapy depends on the last known well time and exclusion of contraindications such as recent surgery, active bleeding, or anticoagulant use. These assessments are critical before administering alteplase or tenecteplase. Question 2. A client with a severe traumatic brain injury suddenly develops a blood pressure of 198/70 mmHg, heart rate of 42 per minute, irregular respirations, and a declining Glasgow Coma Scale score from 11 to 7. Which interpretation by the nurse is most accurate? A. Neurogenic shock causing systemic vasodilation. B. Early septic shock with cerebral hypoperfusion. C. Progressive increased intracranial pressure causing brainstem compression. D. Acute myocardial infarction with cardiogenic shock. Answer. C. Progressive increased intracranial pressure causing brainstem compression. Rationale. Hypertension with widened pulse pressure, bradycardia, irregular respirations, and declining consciousness represent Cushing's triad, indicating life-threatening increased intracranial pressure and impending brain herniation. Question 3. A nurse is caring for a client admitted with a left middle cerebral artery ischemic stroke. Which new assessment finding requires immediate provider notification? A. Expressive aphasia. B. Right facial droop. C. Sudden decrease in level of consciousness accompanied by unequal pupils. D. Right arm weakness. Answer. C. Sudden decrease in level of consciousness accompanied by unequal pupils. Rationale. Unequal pupils and declining consciousness suggest worsening cerebral edema with increased intracranial pressure or herniation, requiring immediate intervention. Question 4. A client with increased intracranial pressure is receiving mechanical ventilation. Which nursing intervention best promotes venous drainage from the brain? A. Position the client flat with legs elevated. B. Keep the head of the bed elevated approximately 30 degrees with the head in a neutral midline position. C. Frequently flex the neck to improve comfort. D. Turn the client into the Trendelenburg position. Answer. B. Keep the head of the bed elevated approximately 30 degrees with the head in a neutral midline position. Rationale. Elevating the head to 30 degrees and maintaining a neutral neck position promotes cerebral venous outflow and helps reduce intracranial pressure. Question 5. A client with a hemorrhagic stroke becomes increasingly restless and repeatedly attempts to remove monitoring equipment. Which nursing action is most appropriate? A. Apply physical restraints immediately. B. Administer prescribed sedation after assessing for neurologic deterioration and identifying the cause of agitation. C. Encourage vigorous coughing to improve oxygenation. D. Place the client flat in bed. Answer. B. Administer prescribed sedation after assessing for neurologic deterioration and identifying the cause of agitation. Rationale. Restlessness may indicate worsening cerebral hypoxia or increased ICP. The nurse should first assess for neurologic deterioration and treat the underlying cause while using prescribed sedation if appropriate. Question 6. A client admitted with a large ischemic stroke suddenly develops projectile vomiting, increasing somnolence, and a sluggish left pupil. Which nursing action should be performed first? A. Administer the prescribed stool softener to prevent straining. B. Notify the rapid response team or provider immediately while preparing for emergency interventions to reduce intracranial pressure. C. Reassure the family that these findings are expected after a stroke. D. Encourage the client to perform deep breathing exercises. Answer. B. Notify the rapid response team or provider immediately while preparing for emergency interventions to reduce intracranial pressure. Rationale: projectile vomiting, decreased level of consciousness, and pupillary changes are classic signs of rapidly increasing ICP and possible brain herniation, requiring immediate intervention. Question 7. The nurse is caring for a client receiving continuous ICP monitoring after a traumatic brain injury. Which assessment finding indicates worsening intracranial hypertension? A. ICP of 8 mm of mercury with stable neurological status. B. ICP rising from 12 mm of mercury to 28 mm of mercury accompanied by decreasing Glasgow Coma Scale and new unilateral pupil dilation. C. Blood pressure 128/76 mmHg with equal pupils. D. Heart rate 82 per minute and oxygen saturation of 98%. Answer. B. ICP rising from 12 mm of mercury to 28 mm of mercury accompanied by decreasing Glasgow Coma Scale and new unilateral pupil dilation. Rationale: normal ICP is approximately 5 to 15 mm of mercury. Sustained ICP above 20 to 22 mm of mercury with neurologic deterioration indicates worsening intracranial hypertension requiring urgent treatment. Question 8. A client is admitted with suspected hemorrhagic stroke. Before the CT scan is completed, which provider prescription should the nurse question? A. Establish 2 large bore 4 lines. B. Maintain airway and oxygenation. C. Administer intravenous alteplase immediately. D. Obtain coagulation studies. Answer. C. Administer intravenous alteplase immediately. Rationale: thrombolytic therapy is contraindicated until intracranial hemorrhage has been excluded by non-contrast CT imaging. Question 9. A client with severe increased intracranial pressure begins exhibiting decerebrate posturing in response to painful stimuli. What is the nurse's priority interpretation? A. The client is demonstrating expected recovery. B. Brainstem dysfunction has progressed and immediate intervention is required. C. Pain control is inadequate. D. The client has developed peripheral nerve damage. Answer. B. Brainstem dysfunction has progressed and immediate intervention is required. Rationale: decerebrate posturing indicates severe brainstem involvement and is associated with worsening neurologic injury and impending herniation. Question 10. A nurse is assessing 4 clients in the neurological intensive care unit. Which client requires immediate assessment? A. A client recovering from ischemic stroke with stable right-sided weakness. B. A client with increased ICP whose Glasgow Coma Scale score decreased from 14 to 11 over the last hour. C. A client with expressive aphasia requesting assistance with meals. D. A client with chronic migraine reporting mild headache relief after medication. Answer. B. A client with increased ICP whose Glasgow Coma Scale score decreased from 14 to 11 over the last hour. Rationale: a declining Glasgow Coma Scale score is one of the earliest and most reliable indicators of worsening neurological status and increasing ICP, requiring immediate evaluation and intervention. Question 11. A client with a large ischemic stroke is receiving osmotic therapy for increased intracranial pressure. Which assessment finding most strongly suggests that the prescribed osmotic diuretic is producing the desired therapeutic effect? A. Progressive decrease in urine output with increasing edema. B. Improvement in level of consciousness accompanied by a reduction in intracranial pressure measurements. C. Development of crackles and increasing central venous pressure. D. Persistent unilateral fixed pupil with worsening motor deficits. Answer. B. Improvement in level of consciousness accompanied by a reduction in intracranial pressure measurements. Rationale. Effective osmotic therapy reduces cerebral edema, lowers ICP, and improves neurological status. Question 12. A client with suspected increased intracranial pressure requires endotracheal suctioning. Which nursing action best minimizes further elevation of ICP during the procedure? A. Perform frequent suctioning for at least 30 seconds. B. Hyperoxygenate before suctioning and limit each suction pass to no more than 10 seconds. C. Instill 10 milliliters of normal saline before every suction attempt. D. Suction every hour regardless of clinical need. Answer. B. Hyperoxygenate before suctioning and limit each suction pass to no more than 10 seconds. Rationale. Suctioning can transiently increase ICP. Pre-oxygenation and limiting suction duration help reduce secondary brain injury. Question 13. A client receiving thrombolytic therapy for an acute ischemic stroke suddenly complains of a severe headache, followed by vomiting and increasing confusion. What is the nurse's priority action? A. Slow the infusion and reassess in 30 minutes. B. Stop the thrombolytic infusion immediately and notify the provider. C. Encourage oral fluids to improve cerebral perfusion. D. Administer aspirin as prescribed. Answer. B. Stop the thrombolytic infusion immediately and notify the provider. Rationale. Sudden severe headache, vomiting, and neurological deterioration during thrombolytic therapy suggest intracranial hemorrhage, a life-threatening complication. Question 14. The nurse is monitoring a client with increased intracranial pressure. Which finding is the earliest indicator of neurological deterioration? A. Bilateral fixed and dilated pupils. B. Loss of brainstem reflexes. C. Decreasing level of consciousness. D. Decerebrate posturing. Answer. C. Decreasing level of consciousness. Rationale. A decline in level of consciousness is typically the earliest and most sensitive sign of increasing ICP. Question 15. A client is admitted with a right hemispheric ischemic stroke. Which assessment finding is most consistent with this diagnosis? A. Expressive aphasia. B. Right-sided hemiplegia. C. Left-sided neglect and impulsive behavior. D. Inability to understand spoken language. Answer. C. Left-sided neglect and impulsive behavior. Rationale. Right hemispheric strokes commonly cause left-sided neglect, impaired judgment, impulsivity, and spatial perceptual deficits. Question 16. A client with severe cerebral edema begins demonstrating unilateral pupil dilation, worsening hypertension, and bradycardia. Which complication should the nurse suspect? A. Hypovolemic shock. B. Brain herniation. C. Neurogenic bladder. D. Acute renal failure. Answer. B. Brain herniation. Rationale. Unilateral pupil dilation with Cushing's triad strongly indicates impending brain herniation, requiring immediate intervention. Question 17. The nurse is caring for a client with acute ischemic stroke who is unable to swallow safely. Which intervention should be implemented first? A. Begin a regular diet with supervision. B. Keep the client NPO until a swallowing evaluation is completed. C. Encourage drinking fluids through a straw. D. Administer oral medications with water immediately. Answer. B. Keep the client NPO until a swallowing evaluation is completed. Rationale. Dysphagia significantly increases aspiration risk. Oral intake should be withheld until swallowing has been evaluated. Question 18. Which physician prescription should the nurse question for a client with documented increased intracranial pressure? A. Elevate the head of the bed to 30 degrees. B. Maintain the neck in a neutral position. C. Encourage vigorous coughing and Valsalva maneuvers every 2 hours. D. Administer prescribed osmotic therapy. Answer. C. Encourage vigorous coughing and Valsalva maneuvers every 2 hours. Rationale. Coughing and Valsalva maneuvers increase intrathoracic pressure, impair cerebral venous drainage, and raise ICP. Question 19. A client with a hemorrhagic stroke suddenly becomes difficult to arouse. Which nursing assessment has the highest priority? A. Assess bowel sounds. B. Assess pupillary size and reactivity. C. Measure abdominal circumference. D. Inspect the skin for pressure injuries. Answer. B. Assess pupillary size and reactivity. Rationale. Changes in pupil size or reactivity may indicate worsening intracranial pressure or brain herniation and require immediate evaluation. Question 20. The nurse receives report on 4 neurological clients. Which client should be assessed first? A. A client recovering from a transient ischemic attack awaiting discharge teaching. B. A client with an ischemic stroke whose NIH stroke scale score increased from 8 to 14 within the past hour. C. A client with chronic multiple sclerosis requesting pain medication. D. A client with Bell's palsy requesting assistance with meals. Answer. B. A client with an ischemic stroke whose NIH stroke scale score increased from 8 to 14 within the past hour. Rationale. A rapidly worsening NIH stroke scale score indicates acute neurological deterioration and possible expansion of brain injury, requiring immediate assessment and intervention. Question 21. A 59-year-old client with a massive left hemispheric ischemic stroke is admitted to the neurocritical care unit. 4 hours later, the nurse notes that the client is increasingly difficult to arouse. The right pupil is now larger than the left and sluggishly reactive, and the client demonstrates extension of both upper extremities to painful stimuli. Which nursing action is the highest priority? A. Continue neurological assessments every 4 hours as prescribed. B. Notify the provider immediately and prepare for emergency interventions for impending brain herniation. C. Administer the prescribed stool softener to reduce constipation. D. Lower the head of the bed to improve cerebral perfusion. Answer. B. Notify the provider immediately and prepare for emergency interventions for impending brain herniation. Rationale. A declining level of consciousness, unilateral pupillary dilation, and decerebrate posturing indicate impending brain herniation requiring immediate intervention. Question 22. The nurse is caring for a client receiving continuous intracranial pressure monitoring. Which value requires immediate intervention? A. ICP of 9 mm of mercury. B. ICP of 13 mm of mercury. C. ICP sustained at 26 mm of mercury for 10 minutes despite positioning interventions. D. ICP of 15 mm of mercury after repositioning. Answer. C. ICP sustained at 26 mm of mercury for 10 minutes despite positioning interventions. Rationale. Sustained ICP greater than 20 to 22 mm of mercury is abnormal and requires immediate treatment to prevent secondary brain injury. Question 23. A client with increased intracranial pressure suddenly begins vomiting immediately after being repositioned. Which nursing intervention is most appropriate? A. Continue turning the client every 15 minutes. B. Assess neurological status immediately and minimize activities that increase ICP. C. Encourage the client to cough forcefully to clear secretions. D. Place the client in the Trendelenburg position. Answer. B. Assess neurological status immediately and minimize activities that increase ICP. Rationale. Sudden vomiting may indicate worsening ICP. Neurological reassessment and minimizing additional ICP elevation are priorities. Question 24. A client is admitted with an acute ischemic stroke affecting the dominant cerebral hemisphere. Which finding is most expected? A. Left-sided neglect. B. Expressive aphasia. C. Impulsive behavior with poor judgment. D. Visual spatial deficits without language impairment. Answer. B. Expressive aphasia. Rationale. The dominant, usually left, hemisphere controls language. Injury commonly causes expressive or receptive aphasia. Question 25. The nurse is caring for a client receiving hypertonic saline for cerebral edema. Which assessment finding indicates that the therapy is producing an adverse effect? A. Serum sodium of 146 milliequivalent/L. B. Improved level of consciousness. C. Crackles in both lung bases with increasing respiratory distress. D. Decreasing intracranial pressure. Answer. C. Crackles in both lung bases with increasing respiratory distress. Rationale. Hypertonic saline may cause intravascular volume overload and pulmonary edema, requiring prompt evaluation. Question 26. Which assessment finding most strongly differentiates increased intracranial pressure from an uncomplicated ischemic stroke? A. Sudden unilateral weakness. B. Facial drooping. C. Progressive decline in level of consciousness with Cushing's triad. D. Dysarthria. Answer. C. Progressive decline in level of consciousness with Cushing's triad. Rationale: Cushing's triad, hypertension, bradycardia, irregular respirations, is characteristic of critically elevated ICP rather than an uncomplicated ischemic stroke. Question 27. A client with a hemorrhagic stroke is receiving nicardipine to control blood pressure. Which outcome best indicates effective therapy? A. Blood pressure falls abruptly to 90/50 millimeter of mercury. B. Blood pressure decreases gradually into the prescribed target range without neurological deterioration. C. Heart rate increases to 140 per minute. D. The client develops worsening confusion with hypotension. Answer. B. Blood pressure decreases gradually into the prescribed target range without neurological deterioration. Rationale: blood pressure should be lowered carefully to reduce further bleeding while maintaining adequate cerebral perfusion. Question 28. A client with severe traumatic brain injury becomes agitated during endotracheal suctioning. The intracranial pressure increases from 16 millimeters of mercury to 31 millimeters of mercury. What should the nurse do first? A. Continue suctioning until all secretions are removed. B. Stop suctioning immediately and allow the client to recover while providing oxygen. C. Place the client flat. D. Encourage repeated coughing. Answer. B. Stop suctioning immediately and allow the client to recover while providing oxygen. Rationale: suctioning significantly increases ICP. The procedure should be stopped promptly if ICP rises excessively. Question 29. A client with increased intracranial pressure is receiving enteral nutrition. Which nursing intervention best reduces the risk of aspiration and additional ICP elevation? A. Position the client flat during feedings. B. Maintain the head of the bed elevated approximately 30 degrees during and after feedings. C. Turn the client prone during feedings. D. Interrupt feeding every 10 minutes. Answer. B. Maintain the head of the bed elevated approximately 30 degrees during and after feedings. Rationale: elevating the head promotes venous drainage, decreases aspiration risk, and helps limit increases in ICP. Question 30. The nurse is assessing for clients. Which client requires immediate intervention? A. A client with an ischemic stroke whose blood pressure is 168/92 mmHg and neurological examination is unchanged. B. A client with traumatic brain injury who suddenly develops a fixed, dilated right pupil and extensor posturing. C. A client recovering from a transient ischemic attack requesting discharge instructions. D. A client with chronic epilepsy resting comfortably after receiving anti-seizure medication. Answer. B. A client with traumatic brain injury who suddenly develops a fixed, dilated right pupil and extensor posturing. Rationale: a fixed dilated pupil with decerebrate posturing indicates impending brain herniation and is a neurological emergency requiring immediate intervention. Question 31. A 72-year-old client with a large cerebellar hemorrhage suddenly develops difficulty maintaining oxygen saturation, increasing somnolence, and new onset bilateral pupillary dilation. The intracranial pressure has increased from 18 millimeters of mercury to 35 millimeters of mercury over the past 20 minutes. Which nursing action should be implemented first? A. Increase environmental stimulation to improve the client's level of consciousness. B. Notify the provider immediately while preparing for emergency airway management and interventions to reduce intracranial pressure. C. Encourage the client to perform deep breathing exercises. D. Administer the scheduled oral antihypertensive medication. Answer. B. Notify the provider immediately while preparing for emergency airway management and interventions to reduce intracranial pressure. Rationale: rapidly rising ICP, declining consciousness, bilateral pupillary dilation, and worsening oxygenation indicate impending brain herniation requiring immediate airway protection and emergency treatment. Question 32. The nurse is caring for a client with acute ischemic stroke. Which assessment findings suggest the client is developing cerebral edema? A. Gradual improvement in muscle strength. B. Progressive decline in the Glasgow Coma Scale score over several hours. C. Blood glucose decreases to 90 milligrams per deciliter. D. Heart rate increases from 72 to 80 beats/min. Answer. B. Progressive decline in the Glasgow Coma Scale score over several hours. Rationale. A worsening level of consciousness is one of the earliest signs of cerebral edema and increasing ICP following an ischemic stroke. Question 33. A client with increased intracranial pressure begins to exhibit Cushing's triad. Which assessment findings should the nurse expect? A. Hypotension, tachycardia, and shallow respirations. B. Hypertension with widened pulse pressure, bradycardia, and irregular respirations. C. Hypertension, tachycardia, and fever. D. Bradycardia, hypotension, and rapid respirations. Answer. B. Hypertension with widened pulse pressure, bradycardia, and irregular respirations. Rationale. Cushing's triad is a late sign of critically elevated ICP and impending brain herniation. Question 34. A client with a left middle cerebral artery ischemic stroke suddenly develops a severe headache, vomiting, and a marked decline in neurological status 24 hours after admission. Which complication should the nurse suspect first? A. Hypoglycemia. B. Hemorrhagic transformation of the ischemic stroke. C. Bell's palsy. D. Peripheral neuropathy. Answer. B. Hemorrhagic transformation of the ischemic stroke. Rationale. Sudden neurological deterioration after an ischemic stroke may indicate hemorrhagic conversion, a life-threatening complication requiring immediate evaluation. Question 35. The nurse is caring for a client with elevated intracranial pressure. Which intervention should be avoided because it can significantly increase ICP? A. Maintaining the head in a neutral midline position. B. Administering prescribed analgesics. C. Performing frequent hip flexion during repositioning. D. Reducing unnecessary environmental stimulation. Answer. C. Performing frequent hip flexion during repositioning. Rationale. Hip flexion increases intra-abdominal and intrathoracic pressure, reducing cerebral venous drainage and increasing ICP. Question 36. A client with an acute ischemic stroke is being evaluated for swallowing ability. Which finding places the client at the greatest risk for aspiration? A. Mild right arm weakness. B. Facial droop with coughing immediately after swallowing water. C. Blood pressure of 170/94 mmHg. D. Complaint of a mild headache. Answer. B. Facial droop with coughing immediately after swallowing water. Rationale. Coughing after swallowing strongly suggests dysphagia and aspiration risk, requiring the client to remain NPO until formally evaluated. Question 37. The nurse is monitoring cerebral perfusion pressure, CPP, in a client with severe traumatic brain injury. Which value requires immediate intervention? A. CPP of 72 millimeters of mercury. B. CPP of 68 millimeters of mercury. C. CPP of 54 millimeters of mercury. D. CPP of 80 millimeters of mercury. Answer. C. CPP of 54 millimeters of mercury. Rationale. CPP below 60 millimeters of mercury is associated with inadequate cerebral perfusion and increased risk of secondary brain injury. Question 38. A client with increased intracranial pressure becomes increasingly restless and attempts to climb out of bed despite repeated redirection. What is the nurse's priority action? A. Apply 4-point restraints immediately. B. Perform an immediate neurological assessment and determine whether the agitation reflects worsening cerebral hypoxia or increasing ICP. C. Leave the client alone to reduce stimulation. D. Administer oral fluids. Answer. B. Perform an immediate neurological assessment and determine whether the agitation reflects worsening cerebral hypoxia or increasing ICP. Rationale. Restlessness and agitation are often early signs of neurological deterioration and should never be assumed to be behavioral without assessment. Question 39. A client with a hemorrhagic stroke is receiving frequent neurological assessments. Which change requires the most urgent provider notification? A. Mild headache rated 2 out of 10. B. Slight improvement in speech. C. New onset of unequal pupils and decreased responsiveness. D. Blood pressure decreases from 178/96 mmHg to 164/88 mmHg. Answer. C. New onset of unequal pupils and decreased responsiveness. Rationale. Unequal pupils with declining consciousness strongly suggest increasing ICP and impending brain herniation. Question 40. The nurse is caring for 4 neurological clients during shift change. Which client should be assessed first? A. A client with a previous ischemic stroke awaiting physical therapy. B. A client with increased intracranial pressure whose ICP has increased from 17 millimeters of mercury to 30 millimeters of mercury and whose Glasgow Coma Scale score has fallen from 10 to 7. C. A client with chronic Parkinson disease requesting assistance to ambulate. D. A client with trigeminal neuralgia reporting facial pain. Answer. B. A client with increased intracranial pressure whose ICP has increased from 17 millimeters of mercury to 30 millimeters of mercury and whose Glasgow Coma Scale score has fallen from 10 to 7. Rationale. A rapidly increasing ICP with a significant decline in Glasgow Coma Scale indicates life-threatening neurological deterioration requiring immediate intervention. Question 41. A 66-year-old client with a large intracerebral hemorrhage is receiving intensive care. During the assessment, the nurse notes a sudden loss of the corneal reflex, bilateral fixed dilated pupils, and no response to painful stimuli. Which nursing action is the highest priority? A. Continue neurological assessments every hour. B. Notify the provider immediately and prepare for emergency management of suspected brain herniation. C. Place the client in the Trendelenburg position to improve cerebral blood flow. D. Administer the scheduled enteral feeding. Answer. B. Notify the provider immediately and prepare for emergency management of suspected brain herniation. Rationale. Loss of brainstem reflexes, fixed dilated pupils, and unresponsiveness are late signs of catastrophic neurological deterioration requiring immediate intervention. Question 42. A client with increased intracranial pressure is receiving mechanical ventilation. Which arterial blood gas result is most concerning? A. PaCO2 38 millimeters of mercury. B. PaCO2 40 millimeters of mercury. C. PaCO2 55 millimeters of mercury. D. PaCO2 36 millimeters of mercury. Answer. C. PaCO2 55 millimeters of mercury. Rationale. Hypercapnia causes cerebral vasodilation, increasing cerebral blood volume and intracranial pressure. Maintaining normal PaCO2 is essential. Question 43. A client arrives in the emergency department with sudden onset of right-sided weakness and aphasia. The symptoms began 2 hours ago. Which nursing intervention should receive the highest priority? A. Obtain a detailed dietary history. B. Activate the stroke protocol and arrange for an immediate non-contrast CT scan. C. Schedule physical therapy. D. Obtain a routine chest radiograph before further evaluation. Answer. B. Activate the stroke protocol and arrange for an immediate non-contrast CT scan. Rationale. Rapid brain imaging is essential to distinguish ischemic from hemorrhagic stroke and determine eligibility for reperfusion therapy. Question 44. The nurse is caring for a client with severe cerebral edema. Which intervention best helps prevent further increases in intracranial pressure? A. Cluster all nursing care into one prolonged session. B. Space nursing interventions and allow periods of uninterrupted rest. C. Encourage repeated coughing and deep breathing every 15 minutes. D. Keep the room brightly lit throughout the day. Answer. B. Space nursing interventions and allow periods of uninterrupted rest. Rationale. Clustering care can repeatedly increase ICP. Allowing rest periods minimizes stimulation and helps control intracranial pressure. Question 45. A client receiving alteplase for an acute ischemic stroke develops bleeding from the foresight and new onset confusion. Which action should the nurse perform first? A. Continue the infusion and reassess later. B. Stop the alteplase infusion immediately and notify the provider. C. Remove the forecatheter immediately. D. Apply heat to the forced site. Answer. B. Stop the alteplase infusion immediately and notify the provider. Rationale. New neurological changes and bleeding during thrombolytic therapy may indicate serious hemorrhage requiring immediate discontinuation of the medication. Question 46. A nurse is assessing a client with increasing intracranial pressure. Which neurological change is considered a late finding? A. Mild restlessness. B. Slight confusion. C. Fixed, non-reactive pupils. D. Complaint of headache. Answer. C. Fixed, non-reactive pupils. Rationale. Fixed, non-reactive pupils indicate severe brainstem compression and are a late sign of critically elevated ICP. Question 47. A client with an ischemic stroke has an NIH stroke scale score that increases from 6 to 12 over 2 hours. Which interpretation is most appropriate? A. The client is improving neurologically. B. The neurological deficit is worsening and requires immediate evaluation. C. The increase is expected during recovery. D. The score has no clinical significance. Answer. B. The neurological deficit is worsening and requires immediate evaluation. Rationale. An increasing NIH stroke scale score indicates worsening neurological function and may signal stroke progression or complications. Question 48. A client with increased intracranial pressure suddenly develops projectile vomiting without preceding nausea. Which interpretation by the nurse is most accurate? A. The client has developed viral gastroenteritis. B. Projectile vomiting is a classic manifestation of worsening intracranial pressure. C. The enteral feeding formula is being administered too quickly. D. The client is experiencing medication-induced gastritis. Answer. B. Projectile vomiting is a classic manifestation of worsening intracranial pressure. Rationale. Projectile vomiting without nausea is a classic neurological sign of increasing intracranial pressure. Question 49. The nurse is evaluating the effectiveness of interventions to reduce intracranial pressure. Which finding best demonstrates improvement? A. ICP remains at 30 millimeters of mercury. B. Glasgow Coma Scale improves from 8 to 12, and ICP decreases to 14 millimeters of mercury. C. Pupils become bilaterally fixed. D. Blood pressure continues to rise with bradycardia. Answer. B. Glasgow Coma Scale improves from 8 to 12, and ICP decreases to 14 millimeters of mercury. Rationale. Improvement in neurological status accompanied by normalization of ICP indicates effective treatment. Question 50. The nurse is caring for 4 clients in the neurological intensive care unit. Which client should receive immediate attention? A. A client recovering from an ischemic stroke who is awaiting discharge education. B. A client with traumatic brain injury whose intracranial pressure suddenly rises to 32 millimeters of mercury, accompanied by bradycardia, hypertension, and irregular respirations. C. A client with a history of migraines requesting prescribed analgesics. D. A client with controlled seizure disorder resting comfortably after receiving anti-seizure medication. Answer. B. A client with traumatic brain injury whose intracranial pressure suddenly rises to 32 millimeters of mercury, accompanied by bradycardia, hypertension, and irregular respirations. Rationale. An ICP of 32 millimeters of mercury with Cushing's triad indicates impending brain herniation and requires immediate life-saving intervention. Excellent work making it through these challenging neurological emergency questions. Consistent practice with high-level NCLEX scenarios builds the critical thinking and clinical decision-making skills you'll need on exam day and in real nursing practice. If you found this set helpful, continue practicing regularly and revisit the questions until you can confidently explain why each correct answer is right. Thanks for watching, and best of luck with your NCLEX preparation.